Hi, I'm Karen Spriggs, clinical consultant for Coloplast, and today we're going to do a Peristeen product demonstration. In preparation for Peristeen training, you need to gather the items that you will need with the system. Your bag, your pump and tubing, your catheters, either the short or the standard length, and the straps if necessary. The first thing to do in training is to fill your bag with tap water. For training purposes, you do not need lukewarm tap water, but while using it on a patient, you do want lukewarm tap water so that they do not have cramping within the installation. Peel the catheter package slightly open, but leave the catheter in the package. The next thing you want to do is put the parts together. The gray tubing goes to the gray top. The small tubing goes to the small hole. The large tubing goes to the large hole. You want to place it in, push it, and do a half turn, and then pull back just to make sure that it's securely into that connector. Then with your blue tubing, that's going to go onto the end of that catheter that you've peeled open. Again, blue to blue, small tubing to small hole, big tubing to big hole. Again, you're going to push it in, turn it a half a click, and pull it back to make sure that it securely fits into the catheter. The next step is prepping the pump and catheter. You're going to first start by turning your pump to the white or water symbol. Squeeze the black pump 2 to 3 times to get the water infusing into the system. You can watch for the water to fill your catheter, and at that point you're going to flip it over to blue. And at this point you want to wait 30 seconds to activate the hydrophilic coating on the catheter. The next step is to engage the balloon. We already have the pump on the blue balloon symbol. Don't pump the balloon yet when you're doing a patient demonstration. I'm going to inflate the balloon here on this video though today, just so that you see what the balloon looks like when it's inflated outside the rectum. This is one pump of the balloon, and this is 2 pumps. And you can see that that usually will probably do it for most patients to occlude the sphincter muscles. When doing the procedure, the patient or caregiver should be holding the catheter by the finger grips. They should not be holding it back here, as they may place the catheter too far into the rectum. You're going to gently put the catheter into the rectum and do not pass the finger grip. If there's any resistance, you want to stop and reposition. Check to make sure that there's no stool in the rectum, and if possible, try inserting the catheter again until it goes in easily. Once the catheter is in the rectum, you want to squeeze the black pump to inflate the balloon. After one squeeze, gently tug on the catheter to ensure it is properly placed in the rectum. If the catheter isn't placed properly, the balloon may be pumped in total twice for the small or short catheter and 5 times for the standard catheter. The next step is pumping water into the rectum. You want to make sure that you turn the dial to the white water symbol. Make sure that the clinician and the patients know that they need to go back into this counterclockwise motion, because if you go in the clockwise position, you're going to go past that green go button, and that's going to deflate the balloon, and then you're going to basically have to start all over again. So if you turn the dial counterclockwise to white, then you can slowly start pumping the water into the rectum. Once you have all the water instilled into the rectum, deflate the balloon. Again, you want to do a counterclockwise position and turn the dial to the green or go symbol to deflate the balloon. Once the balloon is deflated and the catheter is removed out of the rectum, sometimes it'll come out by itself, sometimes you need to give it a little gentle tug. Have the patient sit on the toilet for 10 to 30 minutes, and this is when they can do anything like stand up, massage their belly, move around on the toilet, anything that helps them facilitate a proper bowel movement at this time. Disposal of the catheter is very easy. Once you're done with the system, you put the catheter back in the packaging, disconnect it from the system, and throw it in the garbage. When finished, we just clean up. The patient needs to wipe their bottom. You then unscrew the water bag from the tubing, rinse the outside of the tubing and lid with warm soapy water, and rinse off. Once you have cleaned up, to store the system, you do need to put the system in the orange or off button. This way, that opens up all the tubing so that any extra water that's left in there can drain out and dry overnight or for the 2 nights before they go back to doing the Peristeen system.